her 7-step guide to younger skin, and of course we're all very interested in this. Hi, Rosemary.
Hello, Maura.
Thank you very much for coming in. Now you're going to give us simple steps that you feel will totally help our skin, and the first one is water and hydration.
Absolutely. Well, people spend their time asking me what's the best moisturiser to use in their skin, and I point out that a moisturiser will only trap the water you have drunk in your diet. So if you don't drink anything, there's no point in trying to put a cream on and think that your skin is going to feel nice and moist. So start with water. We're 80% water, so drink good, healthy water.
When you talk about water, what do you think is the best type of water? Is it the bottled water? Is it filtered water?
Well, I'd be honest there and say I'm not a water expert, but I have a filter on my water at home, and I wouldn't drink tap water unless I was very confident about the source. A lot of our tap water has a lot of heavy metals, and then whether or not it's still or sparkling is your preference. I prefer still.
Okay, so really it is important to, whether it's just one of those hand little filters you get at home or have one in your tap and drink a lot of it. Would you say, we always hear 2 litres a day or 8 glasses a day. What do you feel is the ideal optimum amount?
I think that's a good average. Of course, it depends on what size you are. So you can drink too much water, so, you know, you don't want to do that. But what I often advise people to do is get a bottle, maybe a litre or a litre and a half. Fill it up in the morning, fill it up in the afternoon, because then you know you've consumed that amount. Whereas if you rely on going to the bathroom or going to the water cooler and getting a cup, the morning could go and you've been too busy and you've forgotten.
Now, Rosemary, I know I'm staying on harping on the water a lot, but you say you can drink too much. Would that mean you could deplete minerals from your body if you drink too much?
You create a medical condition called diabetes insipidus, and you dilute your serum and your sodium drops, and you can get very sick. Now, it's rare, but in case somebody just goes overboard in the water, you're not meant to drink 4 or 5 litres a day.
Okay, very good. So, you know, as long as you're
All things in
hydrating
moderation.
yourself. Now, we've got some props in front of us here on the table, and we just want to take a look at the food first. A high-protein, low-sugar diet, do you think that's the optimum diet for good health and good skin?
Well, in an ideal world, Maura, but we've all got very sweet tooths. In fact, people say that sugar is a #1 toxin and that we're all poisoning ourselves with sugar. And then it's meant to attach to the collagen and elastin and break down and glycosylate. So a high-protein diet builds tissues and allows tissue repair, and sugar breaks down. Also, people will get surges of sugar. The more sugar you eat, you get a surge, you create insulin, your blood sugar dives, you feel rotten, your energy goes down. And
we always hear sugar in relation to a word that anyone who's kind of reads health magazines or beauty magazines would hear, free radicals. And these are what kind of causes our skin to age.
Certainly part of the picture, yes.
Okay, so these are, what are they, breakaway molecules in your skin?
That's it. They're these sort of charged oxygen atoms that can break down tissues.
Okay, so eat a lot of, I suppose, fish and eggs, that type of thing will help your skin.
And protein, and keep your carbohydrates in moderation.
Okay. Next you say, of course, sleep. Beauty sleep, 8 hours a night?
Again, some people, Maggie Thatcher did brilliantly on 4, so does Barack Obama. I need 8. So, you know, whatever you need, listen to your body and don't try and cheat it. You know, do what you do.
But I know, I think you were saying, or some of the notes you gave us, that the surveys that are done on people that get a lot of sleep, that their skin is actually thicker. That their skin is thicker because they get more sleep.
So the surveys say.
Yeah. Okay. So sleep is very important. Regular exercise as well is very good.
Keeps you healthy.
Except
for, I have to say, sometimes I think there's an element of jogger's face, and sometimes I see women who become very keen on jogging. Now, this isn't all joggers, and I don't want to be killed for it, but they pound the pavements, they're getting a lot of weathering, a lot of sun damage, and they can often lose all the fat pads from their face and get quite haggard and drawn looking.
Okay, so really, do you think for women now that gentler exercise, say something like yoga or Pilates, is better as opposed to something very aggressive? Because, I mean, the whole boom in boot camps and, you know, quick fire type of exercising has become the trend in the last couple of years.
I think you're right, but again, a little bit of everything. I think walking is a fantastic exercise. You can do very little damage walking. And then yoga and Pilates, they stretch you and they strengthen your core. So again, I'm afraid all things in moderation. Okay,
and when you exercise, is it the fact that your blood flows quicker to your skin that it can improve your skin?
There's that, and you release endorphins and you feel better and happier. And it's about being attractive, not just looking younger. And happy, you know, smiley, positive thinking people are happier, they're more attractive. And sometimes you meet people, they look marvellous, and you're not looking at their wrinkles, you just know they look very well.
Because they're positive, got a good attitude.
And their eyes are bright and healthy. And
So positive, you're saying the biggest and most important thing to use on your skin, moisturiser-wise, is sunscreen.
Sunblock.
It is so important, even if the weather is not scorching. You said you should use a sunblock 365 days a year.
Yeah, well, I've now coined a term this week, a daylight block.
Yeah.
Because people keep saying to me, but there's no sun out there. But once there's daylight, there's UVA, there's UVB, you can get skin cancer, wrinkles, sun damage, etc. So 365 days a year. And different sunblocks for different occasions. As you'll see from the variety you have there, some are for exercise and being on the beach, and others are for being at the office.
Okay.
You know?
Then there is this other argument that has certainly come to the fore in the last couple of years, that we're all, well, I suppose it is true, and rickets is back in places like Australia where people are plastering their kids in factor 50 every day and not getting enough vitamin D.
Yeah, I'm glad you mentioned that, because in the last year or two, a lot of studies have come through to show that we are vitamin D depleted, particularly say studies done on patients with skin cancer who are avoiding the sun and their vitamin D levels are in the boots. And vitamin D is very good. It's on every cell in the body, and it's good to reduce your risk of cancer in midlife as well as mind your bones.
Do you think you should take a supplement if you are using an awful lot?
Yeah, definitely.
Take a supplement of vitamin
Definitely.
D. Vitamin D3 probably, is it?
Vitamin D3, 1,000 to 5,000 units a day.
That high?
Yes.
Okay. All right. I just wanted to get in a few of viewers' questions. Any tips on rosacea? But I can't afford expensive creams. This is what one viewer asked.
Number one, go to the doctor if you have rosacea. And number two, ranges like La Roche-Posay and Roc are not expensive and they're very effective. But if you have rosacea, you probably need medical treatment. Okay,
so ranges like La Roche-Posay, and these are skin creams that are actually recommended by dermatologists in France.
Oh, they're excellent.
They are. Okay, another viewer got in touch. I'm 25. I'm starting to get thread veins on my face. What's causing them? How do I get rid of them? Of course, our skin, because we have that Celtic skin. We're very prone, aren't we?
We are. So genetics would probably be the biggest cause. Sun damage would be the next, and then they may or may not have some rosacea. What gets rid of them? Laser.
Okay.
Intense pulse light therapy.
Intense pulse light therapy. Yeah. And that does work. That's what just closes the capillary, is it?
What it actually does is fries them. It heats the blood in the blood vessel, which kills the blood vessel wall, and then it disappears over a few weeks.
Very good, because really it's terrible if you have too many of those in your face. I just want to mention just quickly, actually we probably have some photos of fillers and Botox and all that. Tell us about what a filler can do, and tell us what a filler is.
Okay, well, the fillers I like to use are composed of high hyaluronic acid, which is the safest filler in the world. It's the lowest risk of allergies, and it's fully reversible. So if you don't like the results, you can dissolve it all out in a half an hour with an enzyme.
Now, does filler get rid of wrinkles, or does it plump up your skin? What's the difference?
A little bit of both, but it's mainly used for wrinkles, for small, fine lines, whereas volumizers like Sculptra and polylactic acid would create the oval appearance to the face. So it would take away the gaunt. When we get older, we burn our fat pads and we lose a lot of volume from our cheeks and temples, and it looks very drawn and tired. So that would be a volumizer. Okay, let's take a look at the next photo we have here. We can just take a look back there at it now. This is Sculptra, is it? Sculptra. Okay, tell us what this is done here around the chin. Well, if you look at the picture on my side here, there's volume loss just below the corner of the mouth, and it's corrected, and it made a very big difference to her face. Right, how long does it last? 5 years. Oh, very good. Okay, thank you very much, Rosemary, for coming in. There are some other, of course, questions we couldn't get through, but we got through as much as we can, and all the information from Dr. Coleman is on our website.